you would please call the row.
Senator Boswell. Here. Senator Douglas.
Here.
Senator Thomas.
Here.
Representative Chester Burton.
Here.
Representative McCool. Representative Pollock. Representative Hart.
Here.
Chairman Meredith.
Present. So now we do have a quorum. And again, appreciate everybody's patience as we work through this time of year. You know, it's very difficult to hold a meeting when you're waiting for everybody to adjourn from session, but I appreciate everybody's indulgence. But I can't promise we'll be this timely next month because, you know, as we get further in session, the longer the days. But we'll try to do this as quickly as possible. Appreciate everybody attending. First item on the agenda is consideration of the minutes of the January 9th, 2024 meeting of the committee. There's a motion that they be considered as being approved. Motion. Boswell, Senator Boswell, second by, I think, Co-Chair Hart. If not, I just volunteered him. Kim. I stand corrected. We'll do this properly. I won't get in such a hurry, Representative Chester Burton, that I want to foul things up. Motion is made by Senator Boswell, seconded by Representative Chester Burton. Kim, please call the roll.
Senator Boswell.
Here.
Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Here.
Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye.
And I'm an aye.
I believe that was Senator Douglas who was an aye.
And I.
An aye.
And I.
An aye.
I was the initial aye.
And I.
I was too. He was follow-up aye.
Here, and I thought this was going to be a quick meeting. Okay, motion carries. Total number of items on the agenda today are 271 in the amount of $90,646,478.53. All vendors are registered with the Secretary of State's office, and going to deviate from the agenda just slightly. Senator Boswell has a comment, I believe.
I was going to do it at the end, but that's okay.
Well, thank you, Mr. Chairman. I just want to make this comment. You know, I'm on appropriations and revenue, and we're getting hundreds of requests, as it's natural for people all over the state to support various causes. And I would urge some of these groups to take a look at these contracts that we have to approve here every month. Today, $90 billion.
Million.
Okay, you while you want to go, I thought you said it was big. That's a lot of money. Yeah, we've had times though when we came in here, and I think the number was in the B. Nevertheless, that's a lot of money to me. So we try to scrutinize these contracts up here, but we have somewhat limited authority, as we found out in the past, to try to get something done. So I would just say again, there's a lot of money spent up here, and I think that probably some of this money could be used for other causes.
Thank you, sir. Duly noted. Next is the deferred list, which is from the January routine MOA pink list, and is number 21 from the Attorney General's office, and they're anxiously standing by. If you would, please come to the table, and we'll proceed with this. If you would, please make sure your microphone is on. Green button. Green light should be on. We're good. If you would, please identify yourself for the record.
Sir Chris Evans, Executive Director of the Opioid Abatement Commission, Office of the Attorney General.
My name is Elle Travis with Yes Arts.
Thank you for being here this afternoon. If you would, please raise your right hand. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
I do.
Thank you. Appreciate that. I request this contract be pulled because it's kind of unique. And again, nothing wrong with the contract, but I want to give an opportunity to explain to the committee. It's kind of unique coming from opiate abatement that we're talking about a program that deals with the arts. So into Senator Boswell's comments, you got to wonder, opiate abatement, arts. So I'd like to know how this contract works and how you measure success from it.
Wonderful. Is it okay if I go forward? Awesome. Again, I'm Elle Travis with Executive Director of Yes Arts, and first I want to thank you all for your due diligence on just ensuring that these opioid dollars get spent correctly in our state. I think that that's a tough job. Our mission at Yes Arts is mobilizing the community and the arts to disrupt the cycle of addiction. And so we are working in primary prevention all the way through recovery. We do have programs with drug court and treatment, art therapy treatments that are with people who are already in recovery. But a few years back, we took a look at the cycle of addiction and the impact it has on families and children. And so this particular opioid abatement request is for funds to grow our evidence-based programs, which would implement in coordination with community partners for our prevention program, which is primarily for at-risk youth. Our request was for $200,000 to be spent solely on personnel. That's for leadership coordinators, art therapists, and peer support. Our team consists of educators, social workers, mental and behavioral health practitioners, artists, parents, volunteers, and people in recovery. And we're firm believers that programs should be facilitated by people with lived experience. Our team is also trained on trauma-informed care, implicit bias, mental health first aid, neurodiversity, and ACEs, which are adverse childhood experiences. And some examples of that would be neglect, abuse, household dysfunction, incarcerated parents, and other factors that would increase the risk for opioid use in their later days. And our focus primarily in this universal prevention program being on those protective factors to balance and counteract those ACEs, and to reduce the risk of opioid use later and to mitigate the harm due to generational trauma. Some protective factors to those ACEs include safe and stable nurturing relationships, finding mentorships and increased connection with trusted adults, and community building through positive peer relationships and youth engagement. So all of those things are what our youth prevention program offers. This targeted approach is designed to develop key competencies for our youth, such as emotional regulation, positive self-concept, and problem-solving skills and resiliency. And thank you, Senator Meredith, for asking about how we measure success. I always love that question. How do you measure prevention? And it's really the lack of young children falling into addiction. So
You're the first one who has loved that question. Thank you. I appreciate it.
but I like it, and I love data. And in Frankfurt, we have a saying amongst partners. We have 7 partners who applied for these funds, and we like our data like we like our vegetables, local and fresh, and we want it now. And so that is one of our primary ways that we do measure our goals and outcome. First, we identify who at-risk youth are in our community, and we do that through partnerships with our local schools, other nonprofit organizations, and other community partners, such as the health department. And we identify what those ACEs are and what makes a child at risk. And that looks like truancy, disruptive behavior, alternative school placement, parental incarceration, and of course a family history of substance use or lack of age-appropriate supervision. And then once we focus in on who it is that we're serving, those outcomes become very measurable. And the things we look at are increasing those protective factors. And we do that from data from the annual survey with, it's our annual countywide youth survey implemented by the Franklin County Health Department. So that gets us that fresh local data, and we've been implementing that since 2020. So we have a number of years of data to look at. That documents the use of youth in our community's tobacco, alcohol, and drug use, as well as risk and protective factors. And we're able to really look and hone in on those numbers about students who report in participating in arts-based programs, music, drama, and or dance outside of school time, as well as other factors. We also look at total youth overdoses and hospitalization related to opioid or substance use in our community, juvenile offenses and incarceration related to substance use. And then we work closely with the schools on alternative school placements, disciplinary action, dropout rates for students with a known history, and identified issues with substance use. So all of those are really measurable outcomes. We also measure our programmatic success, and it's my personal favorite type of data, and that's with our impact statements and our surveys. And we do provide those to all of our at-risk youth, families, parents, and caregivers. And so those really give us the qualitative data where we're able to hear about the stories and the people that we're making an impact on and how it's affecting people in our community. And so those surveys cover things like on-site experiences with safety, acceptance, positivity, mentorship, friendship, and other protective factors. And of course, those provide that vital feedback to self-assess programmatic effectiveness and goal achievement. And some of those outcomes are immediate, such as connecting our youth to a wraparound service with a community partner. Others will be statistically validated as our programming is in place long enough for access to the at-risk youth and for a longer period of time. All of our programs that we offer are evidence-based, and our approach is based on models and interventions that have known success over time. So we're not reinventing the wheel. We feel very confident that the programs that we're offering, we're doing our due diligence to ensure that from start to finish, we're looking at every piece and every part to be sure that we're making that impact. So with that, we align for the criteria of funding under KRS 15.2915, and I just hope that you all will give us your blessing.
You know, you got a start date on this of January 15th. So is this a new initiative from the Attorney General's office or Mr. Evans? Because you've come to the table now.
Thank you, Senator. So this is part of the second round of applications which were processed through the Opioid Abatement Commission. So this is that process that it's going through, and that's the established mechanism that we're utilizing for that.
And obviously this runs through 2024. So what's the ask for the next biennial budget?
So Senator, the question is, if they ask for next one, there would need to be an application, again, to go through the process for the commission to receive funding, which would be reviewed by the subcommittees and then would go to the full commission for approval and recommendation that would, again, come to this committee. So again, that would be incumbent upon the organization to apply again for another round of funding from the commission.
Okay, good. Co-Chair Hart has a question.
I'm just curious. I know you go hand in hand with the school systems, but when you administer your program, are you doing it within the school systems, or do you have a center that the students come to? I was just curious on how the logistics is handled, I guess.
Thank you, Representative. We have a facility. We're located right in downtown Frankfort at City Hall. So it's Yes Arts Center at City Hall, and we have a beautiful ADA compliant facility with multiple program rooms, and we also take programs to the schools. So we do a little bit of both. Currently, if you think about our alternative school, which is called the Academy, our Academy students, those are at-risk students in middle and high school, come to Yes Arts 3 days a week for their arts credit, and that is all provided by our trauma-informed program leaders and supported by the school staff who travel down to the building with them. So that's just one example of one of the programs we're running during the school year.
Okay, well, thanks.
Thank you.
Senator Douglas.
Thank you, Mr. Chairman. May I ask more than one question?
More than one, but less than two.
Okay. You may have already answered one of my questions, because my first question was going to be, we talk about youth, and I wanted to know what age.
Mm-hmm.
What age?
We actually have programs for children birth through 18. And
18 what?
18 years old.
Okay.
And then, of course, we do have adult programming for people in recovery. Our youth program, we really focused when we first started our youth opportunities at out-of-school time, and so we were looking at school-age children. We very quickly identified through research around ACEs that there is a thing called baby ACEs. Have any of you all heard of baby ACEs? Baby ACEs.
I'm sorry. I'm the rudest one on this panel. With all due respect, I'm just interested in getting my questions
Sure.
answered. May I ask another one, Mr.
Yes,
Chairman?
sir. Please do.
And I do apologize.
Oh, that's okay.
Just in the interest of time. And I will ask this question over and over and over. How does it affect the home environment? Because, you know, we spend millions and millions and millions and millions of dollars on our kids. And anybody who says we don't is just plain crazy. They're not looking at the numbers.
Yeah.
and we still keep serving the same population over and over and over, and we don't see anything happening in the home environments, which is one of my biggest concerns. One of the things I'll keep harping on. So I have two, if I may, Mr. Chairman, and I'll ask them at the same time. How does this change the child's home environment, number one, and have it given up on our parents, number two? And then I'll shut up. Thank you, Mr. Chairman.
I love that question, and I appreciate it. We do work with the parents. We have a lot of programs that revolve around family engagement, and with the intention, that's why we started those toddler programs. It's a grown-up and me style program to encourage those positive protective factors to take place with that child. We also work with our community partners through Just AS and the health department to offer parent cafes, which are parent forums, and we provide the child care while the parents go and facilitate a discussion around whatever the topic may be, tech, safety, or whatever they select to do. And so a lot of what we're doing revolves around the home environment. I can't go into the home and make changes, but we can absolutely give people the education and means to be able to do that. Thank you for the question.
Representative Chester Burton.
Yes, thank you. What percentage of parents participate in your programs?
That's a good question. I wouldn't want to misquote. A lot of our programs are intended directly for the youth, and we don't see the parents. So when we work with, for example, Wanda Joyce Robinson Foundation, they have children who have incarcerated parents. Their caregivers go to those parent forums, but we don't see them at Yes Arts. We see the children. So it would be hard to put a number on how many actual parents get programming through Yes Arts outside of just a few of the family opportunities where we truly bring them in together. But they are getting the programming just in collaboration with those other partners who have applied for the opioid funding, 7 organizations in Frankfurt.
Any other questions or comments? If not, entertain a motion to
Motion to approve.
Motion by Co-Chair Hart, second by Senator Boswell. All those in favor vote aye. All opposed will vote no. Kim, please call the roll.
Senator Boswell. Aye. Senator Douglas.
Aye.
Senator Thomas.
Mr. Chair, I'd like to explain my aye vote if I may.
Yes, sir. Please do.
Yeah. Tell me your first name again.
L.
Yeah. L. There was a lot of questions about this. This was pulled because it was arts programming. I sometimes get the sense when we talk about appropriating money that somehow the arts, aren't worthy or aren't that important when it comes to appropriations. I think just the opposite. I think arts are a very valuable and necessary way in which we spend our money as the public. I have said many times that I think arts represent the soul of our society. Without the arts, society has no soul. So I'm glad to see you doing this. I mean, you answered all the questions directly, very confidently. So I'm glad you're doing this. I'm proud to vote aye for your project.
Thank you, Senator.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. And before we leave the table, Mr. Evans is new to this position that he's in. We had the opportunity to meet him at our Health Services Committee meeting, Senate Health Services Committee in January, and we asked him to kind of give an overview. It wasn't a fair question for him because he's brand new to the position, but again, want to welcome you to the AG's office in the Commonwealth of Kentucky, and this man has a wealth of experience, and I think we're going to see some great results from him, but glad to have you as part of our team.
Thank you very much, and thank you for the opportunity and the support for today. So we appreciate everything you're doing for us.
Well, thank you for being here, including Senator Will Schroeder. We can now head to home and Valentine's Day dinner. So,
Thank you
good
all.
luck. Thank you all. Appreciate you being here. Next order of business, consideration of the agenda, including the deferred list, personal service contract list, personal service contract amendment list, memorandum of agreement list, memorandum of agreement amendment list, and the Kentucky Entertainment Incentive Program agreement list, and the corrections list, except for those items selected for further review. Do we have a motion to consider the contract review without objection? Senator Douglas, was that you? Senator Boswell made the motion, second by Co-Chair Hart. All those in favor of the motion will vote aye. All opposed will vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. First item on the pulled list with the Kentucky Horse Park and is number 3 on the routine PSC green list. Excuse me, it's the goldenrod list. Do you know 8% of men are colorblind? Did you know that? Just found that out recently.
And Mr. Chairman, the rest of them are extremely handsome.
Duly noted. Welcome. If you would, please make sure your microphone's on. If you would, identify yourself for the record.
Thanks, Senator. My name is Lee Carter. I'm Kentucky Horse Park president.
Glad to have you join us this evening, Mr. Carter. I'm sure there's other place you'd rather be, but I really don't have a need to swear you in because just want to use this as an opportunity. Reason contracts pulled, and very rare do we even get contracts from the Kentucky Horse Park. Appreciate the job you do, but this was a retroactive approval. And anybody who's been in this committee before knows that I have a real aversion to those things because I believe in great transparency, making sure that folks are on top of things. And we have seen in the past that folks have given us retroactive requests that really was to attempt to kind of hide something from us. And if you get by this committee, it's like the good housekeeping seal of approval. So just want to suggest to you, I think this incident happened in October. Everyone got the explanation. Very unusual situation, was a crisis situation, but we didn't receive information on this until January. And what I've always asked people to do in this kind of situation, because emergency do arise, is let us know just as soon as possible that there's going to be a retroactive request, and probably would keep you even having to come before this committee. So again, not trying to chastise you or admonish you, just trying to make you aware of how this committee works and what the expectations are. But
Absolutely. Thank you. The particular situation, as you mentioned, actually happened in August 4th. We had a horse, Turk, in our mounted police, present itself with a 101-degree fever that had to have some emergency care. By the time we got the invoice and was able to do the SPR1s, we had to change course in terms of how we presented that, so that caused the delay. And it's never our intent to be late, or we would never hide anything either. It's not our goal to do. We want to be transparent.
and I appreciate that, and we just want to put you in a position where that it looks like you're being compromised. But we have a question from Senator Thomas.
Yeah. Lee, it's good to see you again, but I want to be honest and true to myself. I had said at the last meeting that I do agree with Senator Meredith regarding retroactive contracts. I think everybody knows the law. You're expected to know the law, and that I'm like him. I'm not going to tolerate retroactive contracts. I'm obviously you weren't here, so I'm going to give you a pass. But I do want to. We have a 3 strikes and you rule out here in America. I'm going to honor that. The next time that I see a retroactive contract that comes across here, I am going to vote against it because I'm putting everyone on notice that that's not acceptable. Follow the law, bring them to the committee on time, and we'll take an honest look at them. So I just want to reaffirm what I said before.
Yeah.
I gotta be principled.
And I appreciate that, Senator Thomas. You've always been straightforward with me. One of the things that we are working on is to get a personal service contract in place for this type of care. It's been a challenge over the last few years to get that secured, but we have an RFP that closes later this week. So hopefully we'll get a positive response to that to prevent this from in the future.
Any questions, comments? Not entertain a motion to approve. Motion by Senator Boswell. Is there a second?
Second.
Second by Senator Douglas. All in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
I had to explain my vote.
Yes, please.
I know this is a rarity, but I want to mirror the words of Senator Thomas. For far too often, the committee's kind of been a sort of a punching bag, and that's not going to happen again. So, thank you. Thank you, Mr. Chair.
Senator Thomas.
I want to explain my vote.
Yes, sir.
Okay, I vote aye, and I just want to second what Senator Douglas said. I mean, it's time that either you follow the rules and get it done the right way, or you just pay the price for not doing it.
Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. And again, Mr. Carter, appreciate you joining us this afternoon and giving us some insight of what's going on, and appreciate you listening to us.
Yes, sir. Thank you.
Have a blessed evening. Next item on the pool list are the Administrative Office of the Courts, our numbers 1 and 2 on the routine MOA pink list. And I know representatives are here because they're rushing towards the table. They too must have plans for a Valentine's Eve dinner, or you're just hungry like I am. Co-chair has corrected me that Valentine's Day is tomorrow. I understand that, but some people like to go out the night before, Representative Hart. But if you would, please identify yourself for the record. Make sure your microphone light is on.
All right. Hello, I'm Tammy Brown. I'm the executive officer.
Is it on?
Oh, there we go. Sorry.
Yeah, it's okay.
I'm Tammy Brown. I'm the executive officer for the Department of Financial Services for the AOC.
Good evening. I'm Ashley Clark. I'm the Executive Officer for the Department of Family and Juvenile Services at the Administrative Office of the Courts.
I am Angie Darcy, and I am the Executive Officer of the Department of Pretrial Services with the Administrative Office of the Courts.
Thank you for joining us this afternoon. If you would, please raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
Yes.
Thank you. I request this contract be pulled, and there's another one of those in the area of kind of education. Excuse me a second. First, in the letter of explanation, the funding goes through 2025. And historically, when it goes beyond a biennial budget period, folks come back to this committee saying we need to extend this beyond the biennial budget period. So this one's a little bit confusing. The letter was as to what we're trying to accomplish here today. Certainly we can approve the contract, but what I understand the concern is because it does go beyond our biennial period, that you want us to approve the whole period of the contract.
So tell me, how should we handle that moving forward? Because the contract that we have goes through, it's the federally funded contract that goes through 25 and one goes through 26. So since the contracts are starting now, we went ahead and put in the request to allow you to approve that going forward. Do we need to come back at the end of the biennium and request that?
Yeah, it's a technicality where we ask for an exemption request to extend it beyond and into the next period, and it really is a technical issue more than anything else. I've never known one that we haven't approved.
Okay.
It
It was my
happens-
understanding we had done this before, and so we were just following suit with that, but we can definitely change that.
Okay, again, no issue. But the question I do have is, this is funded by a 100% federal grant. What happens after the grant expires?
Can you all speak more to that part?
At least for the family recovery courts, they the ones in existence already are funded by different sources, and so sometimes those are local communities, but they can also reapply for ongoing federal funding.
Well, that's the point I'm getting to, is I've seen a lot of federal grants over the last 7 years I've been in this position, and once they expire, then they become a request for a general fund appropriation. And as Senator Boswell noted earlier, we can't build these things on our infrastructure and expect they're going to continue to be paid for. So I'd like to know what the plan is going forward. And if it is a general fund appropriation, but then this wouldn't happen until 2026, but I would look for an appropriation request. But I think that's a little bit of a challenge, because again, we get millions of dollars in federal grants for new programs, to sustain the programs, and I don't see we're in a position where we continue just to, this becomes a financial responsibility of the state of Kentucky. There's too many other areas that we have requests for. So
And I think that's a good question. I think one of our hopes is, and this is really very exploratory right now, we also have currently doing Senate Bill 90 with, for a 4-year pilot. So this is basically just exploring in a couple areas just to see if we can address some mental health in an urban in a rural area, and just seeing what that looks like. It is, for our part on the pretrial and drug court grant, it is a low amount, so we're not, it is not a lot to absorb either. So these are just for a few positions, in fact 2 with pretrial, and then a couple with drug court, just to see if it's something that we can do to help address mental health early on in the justice system.
Well, I hope it does. But one of the things I've noticed in state government is there's very little accountability for the dollars we spend. That's why I ask almost every appropriation question, every contract, how will you measure success? That's very important to me. I want to know tangibly what's it going to look like. And if we have to make a general fund appropriation, it shows a return on investment.
We have great data with AOC, so I have no doubt that if it's successful, we'll be able to show you the success of it pretty early.
And I can tell you're one of those who just loves data too.
I love it.
It makes you special. I don't. Senator Douglas, question?
Thank you, Mr. Chair. I just have one question. I heard the words, it's not a lot to absorb. Absorbed by who?
Well, it could be potentially with AOC as we expand with pretrial services and we move on. It may be something that, if it's just a couple positions, we've been looking at those positions anyway, particularly with Senate Bill 90 as well. If Senate Bill 90 is a success, then that may be an ask overall with Senate Bill 90. However, we're not there yet, right? We're just
but again, we're trying to anticipate some of this, and I'm still a little lost. Where does the money come from?
So right now it's coming from a federal grant. We've
correct.
applied.
No.
Right.
I got that part. We're past that, because the comment I heard was not a lot to absorb. And
For
my
us.
question is, absorbed by whom? The taxpayers?
Well, I think as we grow in pretrial and as we grow in drug court, it could be something that is absorbed into some of our current positions with AOC. I think is what we're currently looking at. So maybe not more of an expenditure. I mean, that's not, I can honestly say I don't know at this point,
Okay.
but it's something that we're looking at.
Okay, I can buy that answer. I just, when I hear terms like, a lot to absorb, I'm just trying to figure out, it's not a lot to absorb unless you're the one absorbing it.
True.
If it's your neighbor's backyard, you don't really, it doesn't make any difference. But if it's your backyard, it is. And we're trying to be very conscious of the taxpayers' money here. And we have to look in a longitudinal fashion to see whether or not that money's going to be there. And we don't want to sit here and lie to them and say, oh, okay, we're going to have a pilot program, but down the road, some of the people who work there are going to take the money out of their pockets and they're going to pay for it. So you, as a taxpayer, don't have to pay any more money. And I don't think that's what we're saying here.
Right.
I just want to make sure that we're transparent.
Yeah, and I think that once we look at the data and kind of see that and see maybe if we're saving money in other areas, then it might be something that is a cost savings thing for the administrative office of the court as well. So we're hoping that what we can show is we can save money in some of these programs.
Okay, thank you very much. Thank you, Mr. Chairman.
Then I would encourage you to best your ability to document those cost savings.
Definitely.
Had a situation, I think it was 2 budget sessions ago, where we had a request for 200 new social workers, and it's going to save us $20 million. It's a no-brainer. Going to do it. Slam dunk. Where's the savings going to come from? And people looked at me like I had 3 eyeballs. And so I had to ask the question again, where's the savings come from? And again, it's like speaking a foreign language, had to ask it a 3rd time. And the answer 3rd time, well, savings are kind of absorbed in the system. What if it is, then it's not a savings? And, this conversation this evening is very germane because it's a budget year. And our budget's $15 billion, including Medicaid funding, it's $30 billion. But I've heard, have not been able to substantiate it, but I've heard that the financial ask is closer to $100 billion. So folks are going to be disappointed. That's why it's so important to be able to document that the program pays for itself. But wish you the best. If there are no other comments, questions, entertain a motion to approve. Motion by Senator Boswell, second. Second by Co-Chair Hart. All those in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas.
Aye.
Representative Chester Burton.
Yes.
Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. And ladies, appreciate you being here this evening.
Thank
I
you.
hope you've shared with your friends what a positive experience this has been, and so that
Appreciate it. Thank you.
final item on the pulled list with the Department of Public Health is number 41 on the routine MOA pink list. If representatives are here, which I see that they are, please come forward. And you guys brought an army. Is it that big of a contract? Let me look at this again. If you would, please identify yourself for the record. Make sure the microphone light is on.
I'm Bob James, Assistant Director for the Division of Epidemiology.
Dr. Kathleen Winter, I'm the State Epidemiologist and Director for the Division of Epidemiology and Health Planning.
And I'm Andrew Young. I'm the Director of Administration and Financial Management for Public Health.
Thank you for being here. If you would, please raise your right hand. Do you swear to tell or affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
I knew you would. Thank you. I pulled this contract because we've had a lot of discussion over the last couple of years about vaccinations, immunizations, and I know you've testified before on this on numerous occasions. My question is kind of on the same line as previous contract. This is federal, 100%, $250,000. What happens after June 2024?
Yeah, we expect that there'll be carryover for this funding to extend into the next fiscal year, so that's our anticipation. But beyond the grant cycle, we don't expect to continue to fund this project. So this is really to build up capacity and education and provide vaccine outreach services. So we don't expect there to be any state funding allocated to this in the future.
Ever, never?
Never, never.
I remember you swore an oath. Got you. It concerns me, you know, agreement descriptions we get kind of vague, kind of nebulous, but provide funds to overcome misinterpretation and misinformation in order to become a trusted messenger among immunized communities. How do you know there's misinterpretation and misinformation? That's pretty subjective criteria.
Yeah, thanks, Senator. That's a good question. So this project is part of a much larger portfolio of projects, which I think you've just referenced earlier, that are to promote vaccine confidence. It comes from funding from the Centers for Disease Control and Prevention, and the goal of this project in this mechanism is to support community-based organizations to provide what we call a trusted messenger to share science-based, evidence-based messaging around immunizations and vaccine-preventable diseases. So this is one of these organizations that we are hoping to support through this mechanism. And we know through evidence-based approaches that if you have what we call a trusted messenger, somebody who looks like you, talks like you, is in your community, sharing information that is science-based, evidence-based, that they have better success of communicating actual data and truth.
Well, looking at the vendor here, it leads me to suspect this is a very finite population, very controlled population. And I guess what I'm getting to is, how was this particular vendor selected? Did you do an RFP, or how did it work?
We had an open RFP for any community-based organization that would meet criteria to be able to apply for these funds.
And how's the service delivered, since we're looking at, you mentioned specifically here, rural, and I assume urban as well, so how do we get that service out?
Yeah, so this is really based in Louisville, so it's actually not just rural, it's urban as well. And we'll be training community health workers. This is a program that's established for community health workers, and providing vaccine outreach, messaging, materials through media, ads and things like that. And also to support direct vaccination services at some of these community events that are already happening.
And public health department can't be a vehicle for that?
We of course do this as well, but again, it comes back to that trusted messenger piece. So, we promote the messaging, we help support whatever materials or content is disseminated, but ultimately it's the communicator that really is the one that has the best luck of providing a strong message. So if I'm one person and I'm a scientist, people aren't necessarily going to listen to me. I don't look like everybody across the state. But if you have somebody sharing those same messages and they look like the community members, they're much more receptive to hearing that answer.
In the agreement description, it does say including rural. So you're saying rural is not going to be part of this?
No, it will be. It will be. But I'm saying it's based out of Louisville, so there will be some Louisville-centered events as well.
So how's it rolled out to the rural communities?
So this is working through some of events where the LGBTQ community is gathered. So it may be other community-based events across the state.
So this is the specific population that we're focused upon.
Yes.
The LGBTQ community.
Yes, sir.
All right. Senator Douglas, you have a question?
Yes, Mr. Chair, but it's difficult to have one. May I have at least two questions?
Check my clock here. Yes, sir. Please.
Okay,
One more.
I'll ask them very quickly. Trusted messenger seems to be becoming buzzwords. And we hear all these new buzzwords being created all the time because people kind of get tired of the old ones or they kind of catch up with the old ones. Is this a new program?
Yes.
Okay. I like your one-word answers. They're great. Are no other organizations doing this?
Not in this way. So I think what's unique about this is that we are taking a community and we're educating them on vaccines so that they can further educate their community.
Okay, but we've got organizations who are communicating, who are educating the community on vaccines. Is that a fair statement?
Yes.
Okay. Are they doing it wrong?
I would not say they're doing it wrong, but we know we have under-vaccination in certain communities. And so this effort is intended to target individuals in under-vaccinated communities and in populations where we know there's increased risk to provide that additional, more direct information.
One more, Mr. Chair, and then I'll shut up.
Yes, please.
This is my third go around with this particular committee, and I've heard this over and over and over about moving in the trusted messenger way and how we need to have like or similar people. I'm just having some issues with, I hear this every year, and I don't know if the people who are coming every time are getting it wrong, so we're gonna do it again with a different organization and put more money into it. Do we need to be taking money away from those previous people who came in and said they were going to do this? No, that's an honest answer. I'm not trying to be a pain in the bottom. We keep layering on, and I'm very concerned about the money that we're using for taxpayers. And the sandwich can only get so thick before you can't get your mouth around it. And so my concern is that we continually have contracts come through here who use the terminology, and then the next year contracts come up. We have new contracts. The old ones are still there, and I'm trying to figure out whether or not we should renew the old ones because the new ones are going to take over, or whether we should continue to pile on to make the sandwich bigger. And that's I'm telling you, that's a very sincere question from me. I'm not trying to put you in any bind.
Well, I can't comment on the effectiveness of those other contracts, but what I can say is some of these are time limited and there's an ongoing need to do vaccine education. There's new vaccines coming out. We know that we have under vaccination. We can document that. We know we have the spread of vaccine preventable diseases. We have the data to support that. So we want to continue to target those high-risk populations that we know continue to have disease.
Thank you. Thank you. Thank you very much, Mr. Chair.
Maybe I can alleviate some of your concerns, Senator. It's federal money, which means we just print more. So they print more. Senator Thomas, you have a question, comment?
Thank you, Mr. Chair. And tell me your last name.
Winter?
Yeah, Ms. Winter, I want to go back to Senator Meredith's question, because I think he asked a fair question. And again, I wanted to echo what Senator Douglas has said. I want to be fair. I'm inclined to support this, but Senator Meredith asked you a question about what rural communities you're going to go to, and you really didn't answer his question. So give me some specifics. There are 119 other counties here in Kentucky besides Jefferson County. Give me an idea of what rural counties you're going to go to.
So this is a project to support vaccine educators within the Louisville Pride organization. And so they will be doing that outreach work at various events where they will be attending. And
well, Dr. Winter, with all due respect, you realize that doesn't answer my question. My question was really specific. What other counties are you going to go to do this work? What other rural counties are you going to go to?
Senator, when you're referring to the rural communities, are you referring to that language that says rural and urban minority communities?
Yes, ma'am. See what it says, that the at-risk population in Kentucky, including rural and urban minority communities.
Sure. And the minority communities that we're targeting with this project specifically include the LGBTQ population, and that is statewide. So we're talking about targeting that. That's the minority community that is being targeted across the state, not just in one geographic location. Their efforts that this organization outreaches to reaches across the state.
Okay, so you mean minority communities in terms of LGBTQ communities?
Yes, sir.
Okay, in what counties?
I would say all 120 counties. There will be events hosted by this organization that will be in various locations.
Okay. I'm going to be difficult here now. Okay. You use the term rural. Okay. What rural communities are you going to go to? I want to answer that question. What rural communities are you going to go to? Louisville's an urban community. So what rural communities are you going to go to? Are you going to go to Ohio County? Are you going to go to Muhlenberg County? Are you going to go to Floyd County? Are you going to go to Lewis County?
Senator, I don't have all the locations of the events that are being...
Give me one.
So what I can say is that this is intended to reach LGBTQ populations that are across the state. It's not just for rural, it's for urban as well. So that is part of this application.
Well, okay. Let's not believe. You realize then by your lack of clarity in answering my question, it doesn't sound like you've identified any rural communities to date that you're going to go to. It's clear you're going to go to Louisville. It's clear you're going to serve the LGBTQ communities. All those are good things, but it's not clear that you're going to serve any rural communities at this time. And that's the clear answer I'm receiving by my question from you.
If I may address, the executive director of Louisville Pride said their greater population served as part of the outreach are the LGBTQIA and allies community, including the greater Louisville area, marginalized urban and rural communities. So according to them, they serve urban and rural communities.
I understand that, but you never have answered my question about what rural communities you're going to serve. You've never answered that question. I'm not going to belabor the point, because I think by me asking the question now for the 6th time and not getting a specific response, it's clear that you haven't identified a rural community yet.
Maybe a more direct question is, how are you going to identify a rural community?
So, Senator, we are working with this organization that already has outreach to communities across the state, the LGBTQ plus population across the state. So they are the ones that will be delivering these messages, providing that outreach. They have podcasts that they are putting together. There's a few different educational outreach opportunities. So those will be not just events and activities that will be occurring in one physical location. They will be accessible to those who already are part of their service network. And that service network does reach across the state into rural communities where there may not be a local center that may support LGBTQ type communities.
Yeah.
I call for a vote.
Is that a motion? Motion and a second. Motion by Senator Boswell, seconded by Senator Douglas. All those in favor of the contract vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell,
I'd like to vote no, and I'd like to explain my vote. I don't vote for funding for issues that only deal with certain segments of our population.
Senator Douglas,
No.
Senator Thomas,
Mr. Chair, I'd like to explain my aye vote. Dr. Winter, I am a strong advocate of the LGBTQ community. Okay. I appreciate your outreach into those areas. Having said that, though, you have misled us. I'm just going to put that on the record, because you haven't identified any rural communities that you're going to go to yet. I don't really appreciate being misled, because I'm a pretty transparent guy myself. You're going to come. They're going to come back here again at some point, aren't they?
I assume in July.
Okay, you're going to come back here in July. When you come back here, I'm going to remember you, Dr. Winter. When you come back here in July, I'm going to give you some homework. I want you to identify 10 rural communities that you've gone to serve the LGBTQ community. They need to be served. But I want 10. I mean, rural communities. Don't give me communities like Spencer County. That's not a rural community. That's a bedroom community of Jefferson County. Don't give me Scott County, because that's a bedroom community of Fayette County. Give me some true rural communities that you've gone to. I want 10 of them when I see you back here in July. But I'm going to vote aye.
Representative Chester Burton,
Yes.
Representative McCool, Representative Pollock, Representative Hart,
Yes.
Senator Meredith,
No. What's the count? Okay, this was the motion approved. It doesn't have the necessary 5 aye votes to move it forward. So as much, we need a motion to disapprove the contract.
Second.
Motion by Senator Boswell to disapprove, seconded by Senator Douglas. All in favor of disapproving the contract will vote aye. All others will vote no. Kim, please call the roll.
Senator Boswell, Senator Douglas,
Aye.
Senator Thomas,
Nay.
Representative Chester Burton,
No.
Representative McCool, Representative Pollock, Representative Hart,
No.
Senator Meredith,
No. Again, the vote is 4-1. It doesn't have the necessary 5 to disapprove the contract. So what will happen, folks, is this goes to the Finance Cabinet for final disposition, and I'm sure they will approve funding. But just like to echo Senator Thomas's sentiments, I hope when you come back in July, when we receive that contract, you can give us more definitive. As to how this program is going to work. But appreciate you being here this evening, and thank you for your time.
Thank you, Senator.
Please take a moment to review items 12 through 15 on your agenda. These are exemption requests. Made reference to these earlier. These are quite routine to take funds through the biennial. I see nothing that's unordinary about this, so if you had a chance to review them, I would entertain a motion to approve the exemption request.
Motion to approve.
Motion by Senator Douglas, seconded by
Senator Hart.
Co-Chair Hart.
Co-Chair Hart. Representative Hart.
Don't fight over it, guys. It'll be all right. All those in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Thomas. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Senator Meredith.
Aye.
Yes.
Exemption.
Exemptions? Okay.
Motion carries. Before we adjourn, please remember that the March 24th meeting will be on March 12th upon adjournment of both chambers. With that, there's no further business. We'll stand adjourned.